Have you ever wondered what your cat is trying to tell you? Cats are notoriously good at hiding their discomfort, making it hard for even the most attentive owners to spot when something is wrong. But what if you knew the subtle signs that veterinarians always look for? In this video, we'll reveal the 15 subtle changes veterinarians would never ignore in their cats, helping you become a more informed and proactive pet parent. Cats are masters of disguise when it comes to illness. Their evolutionary instincts often lead them to hide pain or weakness to avoid appearing vulnerable. This is why paying attention to even the slightest shifts in their normal behavior, appetite, or physical appearance is crucial. These subtle cues can be the first indicators of an underlying health issue. First up, let's talk about behavioral changes. A cat's behavior is a strong reflection of its overall well-being. Any significant deviation from their usual habits can signal something is amiss. It's about noticing what's different from their normal personality. If your typically outgoing cat suddenly starts spending more time under the bed or in secluded spots, it could be a sign of discomfort or fear. Cats often seek isolation when they feel unwell or vulnerable, as a way to protect themselves. Cats usually have a consistent sleep schedule. If your cat is sleeping significantly more or less than usual, or if their sleep locations change drastically, it might indicate pain, discomfort, or an underlying medical condition affecting their energy levels. A sudden shift from a calm demeanor to aggression, hissing, or irritability, especially when touched, can be a clear sign of pain or discomfort. It's their way of communicating that something hurts or they feel threatened. Next, we delve into changes in appetite and thirst. Food and water intake are fundamental to a cat's health. Any noticeable change here is a red flag that veterinarians pay close attention to. A dramatic increase or decrease in how much your cat eats can indicate various health issues. Increased appetite without weight gain could signal hyperthyroidism or diabetes, while a decreased appetite often points to pain, dental issues, or organ problems. An unusual increase in water consumption can be a sign of kidney disease, diabetes, or hyperthyroidism, while a significant decrease might indicate nausea or a fever. Both extremes warrant immediate veterinary attention. The litter box offers a wealth of information about your cat's health. Changes in their habits here are often early indicators of urinary or digestive issues. If your cat starts urinating or defecating outside the litter box, especially suddenly, it's not usually a behavioral issue. It often signals a urinary tract infection, bladder stones, kidney problems, or even arthritis, making it painful to use the box. Changes in the consistency, color, or frequency of urine or stool are also critical. Diarrhea, constipation, blood in urine or stool, or very dilute urine can all point to significant health concerns requiring veterinary assessment. Grooming habits and coat appearance can tell us a lot about a cat's comfort and overall health. A healthy cat typically maintains a clean, shiny coat. Excessive grooming can indicate skin allergies, parasites, pain in a specific area, or even anxiety. Conversely, a lack of grooming often suggests pain, arthritis, dental issues, or general malaise. A dull, greasy, or matted coat, or sudden excessive shedding not related to seasonal changes, can be a sign of poor nutrition, underlying illness, or stress. It indicates their body isn't able to maintain a healthy coat. Moving on to physical changes. While some physical changes are obvious, veterinarians are trained to spot even the most subtle alterations in a cat's body. Unexplained weight loss can be a sign of serious conditions like hyperthyroidism, diabetes, kidney disease, or cancer. Sudden weight gain, especially without an increase in food, can point to fluid retention or hormonal imbalances. Any new lumps, bumps, or swelling, no matter how small, should be examined by a vet. Changes in the color of your cat's gums, pale, yellow, or blue, or the whites of their eyes can indicate anemia, jaundice, or other serious health issues. Lastly, let's consider changes in activity level. A cat's normal energy level is unique to them, but any significant deviation warrants attention. If your usually playful cat suddenly becomes lethargic, unresponsive, or uninterested in their favorite toys and interactions, it's a strong indicator that something is wrong. Pain, fever, or organ dysfunction can all lead to decreased activity. Conversely, increased restlessness, pacing, or difficulty settling down, especially at night, can be a sign of discomfort, anxiety, hyperthyroidism, or even cognitive dysfunction in older cats. It's their way of trying to find comfort. Knowing these subtle signs empowers you to be a more vigilant advocate for your cat's health. If you notice any of these changes, even if they seem minor, it's always best to contact your veterinarian. Early detection is key to successful treatment. And remember, regular veterinary checkups are essential for preventative care, helping catch issues before they become serious. Stay attentive, stay proactive, and give your feline friend the happy, healthy life they deserve.